This is a known patient of mine who had presented with a retinal detachment and macular hole in her left eye and now presented 1 year later with the exact same pathology in her right eye. So the patient had been lost to follow-up and she presented with a chronic retinal detachment as well as a macular hole. She had similar atrophic changes on the inferior part of the retina in her fellow eye. Here we can see that the macular hole is actually two adjacent holes with a sliver of retina in between the two. And then on depressed exam, I was able to identify the small break superior nasally that contributed to the retinal detachment. So the core vitrectomy was performed and the vitreous over the break was shaved. I flattened the retina with a fluid air exchange in order to prevent any of my dual blue dye ending up subretinal through the macular hole. So the dye was placed under the air bubble for approximately 2 minutes. And then once the dye was removed, I injected heavy liquid in order to keep the macula flat and in order to provide some counter traction during my peel. The peripheral vitreous was then removed, and once the peripheral vitrectomy was completed, I drew my attention to the macula, where I used a drop-on lens and a pair of 25 gauge Eckhart microforceps in order to peel the ILM under the PFO. After peeling of the ILM, more heavy liquid was injected in order to displace any remaining subretinal fluid anteriorly. A fluid air exchange was then performed while draining the residual subretinal fluid from the superior nasal break, which I made slightly larger using the endodiathermy. The retina was flattened, and then any residual fluid was removed using the taper tip over the nerve. And given the fact that this patient lives at altitude, I had elected for silicone oil tamponade. But before doing that, of course, all pathology peripherally was lasered using the endo laser. And any final drops of fluid were removed from the eye before injection of silicone oil. The sclerotomies were removed and sutured, and the patient returned at post-op week 1 having a flat retina with a closed macular hole.